Hi, I'm Dr. Rajani. Thanks for joining me today. I'm talking IPL or intense pulse light. I talked about skin glow, we talked about peels, and how to get glow with different procedures you can do at home as well as in the clinic, because no matter what you use at home, a lot of times there's brown spots or particularly red veins. They're harder to get than the brown spots. With the brown spots, you have hydroquinone, kojic acid, certain types of peels that will target them. With reds and vessels, if they're causing dark circles, if they're creating a red nose or you're getting a flushing face, it's very difficult. So I talked about how to get rid of your reds. It brought up IPL or intense pulse light. Today, I'm going to talk about how many sessions you need. I was asked that, how many do you need? Or people say, as with so many of these procedures, doctor, I just didn't see any results. Let's dive into IPL, skin glow, veins, dark spots in 3 seconds. Okay, so intense pulse light or IPL, it's important to know it's not laser. Laser is a focused wavelength, if you want to think of it, of light that targets something specific. IPL is intense pulse light, so you take a broad spectrum of light and you use a filter to give you a range, a smaller range, but not one specific wavelength per se. So it's very different. It doesn't make it safer per se. Some of the worst burns you see could be from IPL. One of the most important things is that you see somebody who knows how to do it, who's used that device, that specific device, quite a bit. Getting to know your device is key. I've had devices over the years that were just so medical grade, meaning they were very intense. If patients had a slight tan, meaning more melanin in the skin, or if they were lighter than prior, it would affect their treatment towards a burn or no results respectively. Because remember, we're trying to target, just say for simplicity here, I mean there's many things you can do, including a little bit of skin tightening with IPL, but let's talk browns and reds because that's what most people want to target. And if you look at that, if you have a lot of browns around the brown spot, you have to be very specific in targeting the slightly darker ones, but not targeting the general skin, or that equals a burn. And that's the problem sometimes with IPL. So just because it's broad-based light that's filtered doesn't mean that you can flippantly use it. They can be very dangerous. And if you've done any yourself, you know when you are treating someone per se and there's something dark on their body, even say we use covers to protect the eyes from the light, or if there was black cloth around the edge and you targeted that, you see a puff of smoke. And that's the burn that it can achieve in the skin should we not be careful. So the question becomes, how many do you need? The short answer is as many as it takes and as good as your provider is. And the reason is, if you're very cautious and you go low energy, see, you can change the amount of energy, the fluence, you can change the pulse width, not to get into too much here, but you can make the light hit, boom, instantly. That's a big hit of energy. Or you can do multiple small pulses and delay how quick the energy comes out of the device. All those things are going to determine the intensity of the treatment, but the safety. And if you're looking at getting results, it's not uncommon to do several a year. So initially, to get up to speed, for instance, I was doing in someone's nose on a male the other day, and when I was doing it, I start slow, a little bit of melanin in the skin. I bump it up over the next treatment. It took 2. I personally want a 3rd. Patient's happy at 2. It could have taken 5 if I was ultra cautious. And people, if they've had a recent burn or striping on a patient, they get cautious all of a sudden for a while because they're a little concerned. And then they bump it up and they get back to their baseline. It's just human nature. You get a little scared. This is a medical grade device. It treats. It has side effects. You have to understand. So if someone's very cautious, you might need several treatments, and you have to be honest with how much you've been tanning. Because if you come in the summer, or if you've been away, or it's sunny year round where you're at and people are doing these, if you've got more sun recently, it's important to let people know. And using sunscreen only blocks at best 50% of the sun. So you have to tell them, I've been in the sun, I'm a little bit darker than normal. It helps them fine tune the machine. So it's important not only for the person doing the treatment, to adjust it, but also for your safety to let them know and let them do a test spot, which often we'll do here. Just test it, wait 5-10 minutes, look for a reaction so we know we have the right parameters and settings. So I think the understanding that you need several treatments to get to where you want to be, and then what? So what do you do when you get to your baseline? And remember, if you like the videos, click like, subscribe, join us here. So when you get to the baseline to where you're happy with your skin, depending on sun exposure, because there's always going to be browns catching up to the surface, because a lot of times the brown spots, the sun damage, the solar damage, we received in our skin maybe 10, 20, 30 years ago. So it's in there, it's just becoming more visible as we age. So they're always coming forward. So regular maintenance of a few IPL a year is key. And remember, I said IPL is broad-based light. So we can use it for overall skin glow. That's a certain filter. We can use it for reds. We can use it for browns. People use it for shoulder pain, knee pain, because the heating can help increase blood flow and help healing, and possibly other factors with the light as well. So understanding that doing a few a year to get browns and reds in a general wavelength, we can do once we've had maybe several treatments to target, say, reds, and then target browns specifically. And it does work with your micro needling. It works with your micro glows, your plasma glows, VFRs, RF micro needling, high frequency ultrasound. Remember, high frequency ultrasound and radio frequency, like Ulthera and Thermage respectively, they're not going to get browns or reds. That's skin tightening. And you'll say, hey, those are $3,000 to $5,000 procedures, and they only get skin tightening and mild to maybe moderate skin tightening. Overall, mild skin tightening, better for those under the age of 50 as a general rule. Yes, it's expensive. So understand, that's why I do a lot for skin tightening, for glow, for tone, for lifting. I do a lot more plasma sculpt, and I talked about it on a video I did recently, how to look younger, 10 years younger. So you can watch that, because a lot of people need structure and support. And when you volumize a face, a lot of the browns go away, because brown skin and any skin gets a little darker as it compresses, as it is deflated. The skin moves together, so does the pigment. So as you revolumize the face, you obtain glow. So that's IPL. You need several to get to baseline, depending on how bad your skin is to start. You might need other services. Your skincare is still important. And once you get to where you want to be, a few a year, all things being equal, are really good to keep things at bay. Let me know your experience with IPL. Have you used it? Do you like it? Have you thought about it? Let us know in the comments. Thanks for joining me here. Keep your skin and body beautiful, healthy, and vibrant.